everyone, I'm Dr. Natalie Teo and I've been a urologist here in Singapore for more than 30 years. I've dedicated my entire career to men's health, especially helping older gentlemen preserve not just their sexual function, but their confidence and identity. What if I told you that the main cause of erectile dysfunction in men above 60 has nothing to do with age, and that one simple daily habit without any medication could change everything? I know, sounds too good to be true, right? But stay with me because what I'm about to share with you today isn't some magic pill or expensive treatment. It's something you can start doing today, and it might just save you from years of frustration and embarrassment. Before we dive in, let me tell you something that happened just last week at my clinic. A 72-year-old uncle came to see me. Nice guy, very fit for his age, doesn't smoke, barely drinks, but he told me, "Doctor, I feel like I've lost part of myself." My wife and I were still close but and he just looked down, couldn't even finish the sentence. This kind of thing, I see it every single day. Men who think it's normal, that it's just part of getting older. But here's what I want you to understand. Just because it's common doesn't mean it's inevitable. And just because you're older doesn't mean you have to accept it. The good news is that most of the problems I see in my practice are completely preventable. Many men have silently accepted the idea that sexual function disappears with age and there's nothing they can do about it. But that's simply not true. Your body changes as you get older, yes, but that doesn't mean you lose control. It means you need to adapt how you care for it. Now, I'm going to share with you 5 essential tips for taking care of your penis. These aren't complicated medical procedures or expensive treatments. These are practical, everyday habits that can make a real difference. And I'm telling you this because after 3 decades of treating men in Singapore, from Ang Mo Kio to Yishun, from Woodlands to Jurong, I've seen what works and what doesn't. So here's what we're going to cover today. First, proper hygiene that most men get wrong. Second, why your diet matters more than you think. Third, the truth about exercise and blood flow. Fourth, what you need to know about underwear and temperature. And fifth, the one habit that's silently destroying your sexual health that almost no one talks about. Let me start with the first one, proper hygiene. Now, you might think, yeah, doctor, of course, I know how to clean myself lah. But here's the thing, it's not about whether you're clean or dirty. It's about knowing how to clean properly. And I can tell you, many men don't. For uncircumcised men especially, you need to retract the foreskin completely when you shower and clean underneath with warm water. No need for harsh soaps or those heavily perfumed body washes you see at NTUC. Just plain water or mild unscented soap is enough. The area under the foreskin is sensitive, and if you use harsh products, you can irritate it or even cause inflammation. This can lead to conditions like balanitis, which is inflammation of the head of the penis. Not pleasant at all. And here's what many men don't realize. Improper hygiene doesn't just affect you, it affects your partner too. If bacteria build up under the foreskin, it can cause infections for both of you. I've had couples come to my clinic because both of them are experiencing problems, and it all traces back to basic hygiene. But there's more to it than just washing. After you shower, you need to dry the area thoroughly. Don't just towel off quickly and put on your underwear. Take a moment to pat the area dry, especially under the foreskin if you're uncircumcised. Moisture creates the perfect environment for bacteria and fungus to grow. And in Singapore's humidity, even worse, our weather is perfect for all sorts of things to grow where you don't want them to grow. Here's your action item for this first tip. Starting today, when you shower, take an extra 30 seconds to clean properly. Retract, clean, dry thoroughly. That's it. 30 seconds that could prevent infections, inflammation, and a whole lot of discomfort down the road. Now let's talk about the second tip. Diet and lifestyle. I know you've heard this a million times, doctor, again with the diet, but hear me out, because this is specifically about how your diet affects blood flow to your penis. Your erection depends entirely on blood flow. When blood flows into the penis and gets trapped there, that's what creates an erection. But if your blood vessels are clogged or damaged, that blood can't flow properly. And what clogs your blood vessels? The same things that cause heart disease, high cholesterol, high blood pressure, diabetes. I had a patient recently, 68 years old, came to me complaining about erectile dysfunction. When I checked his medical history, his cholesterol was sky high, blood pressure also not controlled, and he was pre-diabetic. He asked me, "Doctor, can you give me some pills to fix this?" And I told him straight, "Uncle, pills can help, but if you don't fix the root problem, no amount of medication will work long term." Here's what you need to understand. Your penis is like an early warning system for your cardiovascular health. If you're having erectile problems, it could be the first sign that something's wrong with your heart and blood vessels. The blood vessels in the penis are smaller than the ones in your heart, so problems show up there first. So what should you eat? Focus on foods that improve blood flow. Leafy greens like kailan and spinach, fatty fish like salmon and mackerel, nuts like almonds and walnuts, fruits like watermelon and berries. These foods contain nutrients that help your blood vessels stay flexible and healthy. And what should you avoid? Cut down on the sugar, the fried foods, the processed meats. I know char kway teow and nasi lemak are shiok, but if you're eating them every day, you're setting yourself up for problems. I'm not saying never eat them. I'm saying be smart about it. Everything in moderation. But here's something many men don't know. Alcohol affects your ability to get and maintain an erection, especially as you get older. A beer or two with friends at the kopitiam is fine, but if you're drinking heavily and regularly, that's going to cause problems. Alcohol depresses your central nervous system, which interferes with the signals between your brain and your penis. And smoking, don't even get me started. Smoking damages your blood vessels directly. Every cigarette you smoke constricts your blood vessels and reduces blood flow. If you're serious about maintaining your sexual function, you need to quit smoking. I've seen men in their 50s who quit smoking and saw improvement in their erectile function within just a few months. Your action item for this second tip: look at what you ate yesterday. Write it down if you need to. Now ask yourself honestly, am I making choices that support my health or harm it? If you're not sure, start by making one small change. Replace one unhealthy meal a week with something better. That's how you start. The third tip is about exercise and circulation. This one is huge, and it's something that a lot of men overlook. Regular physical activity improves blood flow throughout your entire body, including to your penis. It also helps you maintain a healthy weight, reduces stress, and improves your mood. All of these things contribute to better sexual function. You don't need to become a gym fanatic or run marathons. Even moderate exercise makes a difference. A brisk walk for 30 minutes a day, 5 days a week is enough to see real benefits. Swimming at the public pool, cycling around your neighborhood, even gardening if you do it actively. The key is consistency. But there's a specific type of exercise I want to tell you about that directly affects your sexual function: pelvic floor exercises, also known as Kegel exercises. Most people think Kegels are only for women, but they're incredibly important for men too. Your pelvic floor muscles support your bladder and bowel, and they play a crucial role in erections and ejaculation. Here's how you do them. First, you need to identify the right muscles. Next time you're urinating, try to stop the flow midstream. The muscles you use to do that, those are your pelvic floor muscles, but don't make a habit of stopping your urine flow because that can cause problems. This is just to help you identify the muscles. Once you know which muscles we're talking about, you can exercise them anytime, anywhere. Tighten those muscles, hold for 5 seconds, then release. Do this 10 times, 3 times a day. You can do it while watching TV, while waiting for the MRT, while sitting at your desk at work. Nobody knows you're doing it, but the benefits are real. Strong pelvic floor muscles help you maintain erections, improve ejaculatory control, and even help with any incontinence issues you might be experiencing. I've had patients who did these exercises consistently for a few months and reported significant improvements. Your action item for this third tip: start moving more. If you're not exercising at all right now, commit to just 10 minutes of walking today and try those pelvic floor exercises right now as you're watching this video. Tighten, hold, release. Do it 10 times. There, you've started already. Now the fourth tip, and this is one that surprises a lot of men: what you wear matters, specifically your underwear and how it affects testicular temperature. Your testicles hang outside your body for a reason. They need to be about 2 to 3 degrees cooler than your core body temperature to produce healthy sperm and hormones effectively. When you wear tight underwear or pants that push your testicles close to your body, you raise their temperature. This can affect sperm production and testosterone levels. Lower testosterone affects your libido and your ability to achieve and maintain erections. In Singapore's hot and humid climate, this is even more important. If you're wearing tight briefs or compression shorts all day, especially in our weather, you're basically cooking your testicles. Not a pleasant image, but it's true. I recommend loose-fitting cotton boxers that allow for airflow and keep things cooler. Also, be careful with hot baths and saunas. Occasional use is fine, but if you're taking long hot baths every day or spending a lot of time in the sauna, that sustained heat exposure can affect your testosterone production. Keep baths warm rather than hot, and limit sauna sessions to 15 to 20 minutes. And here's another thing many men don't think about: laptop computers. If you're sitting with your laptop directly on your lap for hours every day, that heat from the computer is affecting your testicles. Use a laptop desk or table instead. Your action item for this fourth tip: check your underwear drawer. Do you have mostly tight briefs or loose boxers? If most of what you have is tight, consider investing in some loose-fitting cotton boxers. And if you work from home with your laptop on your lap, get a proper desk setup. Your future self will thank you. Now for the fifth and final tip, and this is the one that almost no one talks about but is absolutely critical: managing stress and getting enough sleep. I cannot emphasize this enough. Stress and poor sleep are silent killers of sexual function, especially as you get older. When you're stressed, your body produces cortisol, which is your stress hormone. High levels of cortisol over time suppress testosterone production. It also constricts blood vessels, making it harder to achieve an erection. And the worst part, many men don't even realize how stressed they are. They just accept it as normal. Think about it. You're worried about work, about money, about your health, about your family. All of this accumulates. And when you're lying in bed at night thinking about all these things, how are you supposed to relax and be intimate with your partner? Your body is in fight or flight mode, not romance mode, and sleep is connected to this. When you don't get enough quality sleep, your testosterone levels drop. Most of your testosterone is produced while you sleep, especially during REM sleep. If you're only getting 5 or 6 hours of broken sleep every night, your body isn't producing enough testosterone. And low testosterone means low libido and erectile difficulties. I've had patients who improved their erectile function dramatically just by addressing their stress and sleep. One uncle I treated was working long hours at his provision shop, stressed about competition from the supermarket, not sleeping well. He couldn't understand why he was having problems because he didn't smoke, didn't drink, ate relatively well. But when we addressed the stress and got his sleep back to 7 or 8 hours a night, things improved within a month. So what can you do? First, find ways to manage stress. This is different for everyone. Maybe it's exercise, maybe it's meditation, maybe it's spending time with friends at the coffee shop, maybe it's a hobby you enjoy. Find what works for you and make time for it. Don't tell me you don't have time. You have time to watch this video, you have time to take care of yourself. Second, prioritize sleep. Go to bed at the same time every night. Make your bedroom dark and cool. Don't look at your phone for at least an hour before bed because that blue light interferes with your sleep hormones. If you have trouble sleeping, don't just accept it. Talk to your doctor. There are solutions. And here's something specific for men worried about their sexual function. Performance anxiety is real and it creates a vicious cycle. You have trouble getting an erection once, then you worry about it happening again, and that worry makes it more likely to happen. This is especially true after age 60, when you might need more time or more stimulation to get aroused. That's normal, but if you're stressed about it, it becomes a problem. Talk to your partner. Communication is so important. If they understand what's happening, they can support you instead of both of you sitting there feeling awkward and frustrated. I've seen relationships improve dramatically when couples start actually talking about these things instead of just avoiding them. Your action item for this fifth tip: identify your biggest source of stress right now. Just one thing. Now, what's one small step you can take this week to address it? Maybe it's having a conversation you've been avoiding. Maybe it's asking for help with something. Maybe it's simply deciding to worry less about things you can't control. And tonight, commit to going to bed 30 minutes earlier than usual. Just try it. So those are the 5 tips. Let me recap quickly. Proper hygiene, especially cleaning and drying thoroughly. A diet that supports blood flow, and avoiding things that damage your blood vessels. Regular exercise, including pelvic floor exercises, wearing the right underwear, and managing temperature, and managing stress and getting enough sleep. Now, I want to address something that I hear a lot in my clinic. Men tell me, "Doctor, I'm doing everything right. I don't smoke, don't drink much, I eat pretty well, but I still have problems." If that's you, I want you to know that you're not alone and there could be other factors at play. Sometimes erectile dysfunction is an early warning sign of other health issues like diabetes, high blood pressure, or heart disease. Sometimes it's related to medications you're taking for other conditions. Some blood pressure medications, for example, can affect sexual function. Sometimes it's hormonal with low testosterone or thyroid issues, and sometimes, yes, it's psychological. This is why it's so important to actually see a doctor if you're having persistent problems. Don't just suffer in silence thinking it's normal because of your age. Don't rely on supplements you buy online or pills from questionable sources. Come see a urologist. We can run proper tests, identify the real cause, and recommend appropriate treatment. There are legitimate medical treatments available if you need them. Medications like sildenafil, tadalafil, and others can be very effective when used properly under medical supervision. There are also other treatments like penile injections, vacuum devices, or even surgical options for severe cases. But you need a proper diagnosis first, and I want to emphasize this. Seeking help is not a sign of weakness. It's a sign that you value your health and your quality of life. You wouldn't ignore chest pain or severe headaches, so why ignore sexual dysfunction? It's a health issue that deserves proper medical attention. Here's what I want you to take away from this video today. Your sexual health at 60, 70, 80, or beyond is not predetermined. Yes, your body changes as you age, but that doesn't mean you have to lose your sexual function or your confidence. What you do every single day matters. The choices you make about how you care for your body, what you eat, how you move, how you manage stress, all of it adds up. This isn't about trying to be 25 again. It's about being the healthiest version of yourself at the age you are now. It's about staying connected with who you are and maintaining your quality of life, because here's the truth. When you take care of yourself in these simple but powerful ways, it shows. It shows in how you carry yourself in your relationships with others and in how you feel inside. I know some of you watching this might feel discouraged. Maybe you've been struggling with these issues for years. Maybe you've tried things before and they didn't work. But I'm telling you, it's never too late to start taking better care of yourself. Every positive change you make, no matter how small, is a step in the right direction. If you found this video helpful, please give it a thumbs up and subscribe to my channel. I share practical medical advice specifically for men's health issues, and I want to help as many of you as possible. Drop a comment below and tell me which of these 5 tips you're going to start with. I read every comment and I'll try to respond to as many as I can. And if you have questions you want me to answer in future videos, let me know. I'm planning to cover topics like what to do when medications aren't working, the truth about testosterone replacement therapy, and how to talk to your partner about sexual health issues. So subscribe and turn on notifications so you don't miss those. Thank you for being here, for listening, and for choosing to invest in yourself. Taking care of your health is one of the most important things you can do, not just for yourself, but for everyone who cares about you. You deserve to live your best life at any age, and I'm here to help you do that. Take care, everyone, and I'll see you in the next video.